Hello and welcome to today's presentation from Bausch regarding OccluSense. I hope that everyone can hear and see me. I'm going to try and keep an eye on the chat. So if there's anything, if you have any technical difficulties, feel free to drop me a message in the chat. And if not, I'm assuming that everyone can see my screen and also hear me. So I will get started. So my name is Mina Niknazemi. I'm a dentist at the University Clinic of Cologne, specializing in the prosthodontics department, and I'm also an OccluSense consultant at Bausch. Bausch was established back in 1953, and even then they knew that occlusion plays a very, very huge role within dental treatments. So if we think about what occlusion actually means, then we know it's the contact between the teeth of the upper jaw and the lower jaw. So any adjustments, so for example, restorations in terms of fillings or crowns, mean an intervention in this system, and they must be monitored by the dentist. Dr. Hans Bausch, who was a dentist himself, developed the articulating paper with progressive color transfer back in 1953 because he was aware of the importance of the masticatory forces and their effect on occlusion. To test occlusal measurements. And first, I want you to think about what occlusion actually means. So if we take a moment to visualize the main aspects during static and dynamic occlusion and think about how we currently test this on our patients. We have a gold standard that has not been changed for many, many years. So we have the standard articulating papers in different shapes and forms, and obviously different colors with varying thicknesses, and the standard foil being 8 microns thin. So the current standard to test occlusion in all dimensions is primarily done using different colors. So red, as you can see here, can be used for static occlusion, black can be used for protrusion, and green and blue for dynamic movements, so medial and lateral protrusion. And if we test this on our patients, this is a very time-consuming matter, especially if the process has to be repeated. And that's exactly where OccluSense comes into play. So OccluSense is occlusion in a digitalized manner. And as you can see in the short video here, it consists of a wireless handheld, an electronic pressure sensor that can be placed in your patient's mouth, and then you are able to record any movement that you want. You can see here that the pins and the holes in the sensor are asymmetrically put in there, so you can only put the sensor or insert the sensor into your handheld in the correct way. And once this is done, you can record any movement that you want. So whether it be static occlusion, dynamic occlusion, and the information will then be transferred wirelessly onto your iPad and give you an OccluSense reading, as you can see on the iPad visualization here. And for those of you who don't own an OccluSense yet, I'm going to take you briefly through how it works and what the system consists of. So you saw most of the things in the video previously. We have an OccluSense handheld, an iPad with the OccluSense iPad app. This can be downloaded for free on the Apple Store, as well as a sensor, which is available in 2 different sizes. So we have X and XL, whereby they differ in width rather than length. And these highly sensitive pressure sensors are able to detect 256 different pressure levels while still remaining only 60 microns thin. So they provide a very, very good flexibility and are easy to use on your patients in order to be inserted in the patient's mouth. one very extremely important factor to me is the red color coding. What this means is that if you are using the OccluSense sensor in a patient's mouth, within that same usage where the recording is being made, the color transfers onto the patient's teeth, so you don't have to repeat anything. So this is exactly how you are using your papers and foils, just transferring all the data also digitally. To get started, you are going to need to do an initial setup, and you need to ensure that your iPad is connected to a Wi-Fi connection, and then go onto the OccluSense app and start your initial setup. But you will be guided through every necessary step, so you don't need to worry about yeah, remembering the things that you see here. It's very, very easy to use. And once you have done the initial setup, you're ready to register the system. And I've got a short video for you just showing this now. So that's it. So your system is registered. I've got another short video for you regarding a sensor test. I just want you to see it so you know how it's done. It's very easy. It takes maybe 2 seconds.
Settings in the OccluSense iPad app. With your handheld and the test sensor ready, now tap on Functionality Test Handheld. You will now be asked to insert the test sensor correctly and close the sensor flap. Start the function test. The function test starts now. The result of the function test is displayed in the app. Now, remove the test sensor from the handheld and put it back in the storage box.
I've actually just seen in the chat, thank you, Dr. Walsh. There's no volume on the video. The videos are also on the OccluSense website, so you can access them whenever you want to have a look at them. I'm just going to talk you through what was being said in the sensor test video. So the test sensor, that green little card that you can see, is provided with any OccluSense set. And similar to the sensors themselves, they have asymmetrical pins and holes, so that you have to put them into your handheld, start the sensor test, and then it will automatically do everything else. You don't need to do this before every use of the OccluSense, but every now and then it will prompt you to do so. So depending on your usage, maybe once a day, maybe once every 3 days. So the accuracy of the measurements is maintained. In order to understand why an OccluSense might be useful, I want to compare the current method that we're using, so occlusion control with paper and foils, with OccluSense. And to do this, we will start with paper and foils. So if we are looking at this pathway, then you can see that to get from checkpoint 1, which is our initial contact, via checkpoint 2, so the sliding into intercuspidation, up until checkpoint 3, the maximum intercuspal position, we would have to go from checkpoint 1, 2 to 3. And as we can see that even for static occlusion, this is a process over a period of time. It's not just a singular moment in time. If you want to really get an understanding of the three-dimensional movement within occlusion. And if you're looking at occlusion with paper and foils, you actually only get a snapshot in time at checkpoint 3. So checking occlusion with paper and foils is similar to taking a picture of one moment in time. So it's literally just one moment. With OccluSense, however, you have the opportunity to look at this process at any given moment in time over a period of time. So because we know that occlusion doesn't just consist of the final jaw position, but also the entire movement before all of that, it can give you an equivalent to a video recording. So with OccluSense, you have the opportunity to record a period of time of occlusion. But do we really need this much in-depth information for every single treatment? If we take an implant as an example, we know that the tactile sensitivity, so the threshold of the tactile sensitivity of an implanted construction is about 8 times higher than that of the tactile sensitivity of a vital teeth within their periodont. So any occlusal interferences, as for example, if a construction is too high, if it's too low, they will not present themselves with the same symptoms as they would in vital teeth. So therefore, any disbalance may be disregarded and will be transferred onto the craniomandibular system and cause dysfunctions. There may be plenty of other indications whereby the use of an OccluSense can aid in a better and more precise decision making. So we have the ability to detect hidden or interference contacts fairly quickly. You have the opportunity to detect combined periodontal damage very early and look at them for every individual teeth, as well as look at force distributions of the entire dental arch. You can avoid chipping in that sense if there's no improper loading, and you can record dynamic occlusion on splints, as well as orthodontic changes. And obviously, what you are always doing is you're documenting everything. And you can use the visualization for patient education, which in my experience has been very, very helpful for patients to have something to look at rather than me just explaining to them, this is too high and I need to adjust this. And, when they see something, it's often much easier for them. To use OccluSense, just like any other CRM system, you need to add your patient to your database. And once your patient is added, you have the opportunity to view any past recordings by selecting the patient or start a new recording. And to add the patient, you do the stuff that you usually do. So you enter a first name, last name, gender, birthday, everything. So you're able to trace them back and find them again. What you are also able to do, you can freely select a patient number within the OccluSense system. And this means that you can use the same patient number as your CRM system uses. So you can really, really trace back if you have Frank Miller 10 times with maybe the same birthday. And if you want to use OccluSense for a recording, you select the patient, set them active, and press new recording. You are then prompted to adjust the time and the frequency of the recording, which you can do on the iPad or do it on the handheld. So whatever's easier for you, you have the opportunity to do both. And now you're ready to get started. So you place the handheld into your patient's mouth, instruct them to do whatever movement you want them to do and you would like to have recorded. You can also practice it beforehand. And yeah, the data will then be automatically transferred to the iPad, and that's what it would look like. The colored marks, as mentioned previously, will still be left in your patient's mouth. So any decisions that you want to make in order to adjust the occlusion can be directly made within just one round of OccluSense reading. So this can be done for static and dynamic occlusal movements. you, when you select the time, for example, 10 seconds, it doesn't, if you're using the iPad, straight away start with the 10 seconds when you go start recording. The sensor detects the pressure change automatically and will only start the 10 seconds that you've previously inserted once the first pressure change on the sensor is censored. So you don't need to really quickly put on the gloves and run to the patient. It works quite smartly. And if you have any more questions and you want to read up some more details, we have our instructions for use also uploaded onto our website in different languages. As you saw, the previous example showed an OccluSense reading with different colors and columns. I want to talk to you about what they actually mean. So the colors tell you more about the pressure that is being applied and the size of the contact points, whilst green points represent an area of contact on a wider surface. Orange or yellow displays something in between green and red represents a punctual contact. To further try and understand this, you can take a look at the load of this bridge. So the load of this bridge is being transferred onto the two pillars left and right that are holding this load. And the left pillar has a wider surface contact to the ground, which is characterized in green because I said green, wider contact surface. And the right pillar has a punctual contact surface to the ground, which is why this pillar is red. And the height of the columns display the difference in pressure change that is being obtained. If you take a look at this next example, you can see again, a small pressure change is observed between the green columns, an intermediate pressure change here at orange, and the highest pressure change on red. So in order to transfer this into the three-dimensional movement during mastication, I'd like you to try and imagine you're standing barefoot on a plate covered with needles. And apart from the pain that you're sensing, you can also sense that each and every single needle underneath your bare foot is obtaining a very different amount of pressure depending on how much weight is being put on it. And if we now take a little cutout from this needle plate and pull it over to here, then you can see that on the very left side, if you're comparing the two needles to another, there's a very big pressure change between those, which is why this is red. Next to it, you've got orange. It's a lower pressure change, so we've got orange. Yellow is a bit smaller, so we've got yellow. And green, you have the smallest pressure change compared to the other ones, which is why it's green. Therefore, red columns indicate high spots. They indicate initial contacts or standalone contacts that may or may not be in full intercuspidation, whilst green columns indicate a low pressure difference. So this is, for example, the case in on abrasive teeth when you have very planar contacts or adjacent contacts with a very similar pressure change. What you do need to remember is that red is only a color. You don't need to do anything just because the color is red. If you are looking for a standalone contact on a normal ABC contact and, you know, that's what you want there, then that's not a problem. But you should just be aware that this contact is punctual. And what you should also remember is that all of the pixels within one sensor, so the 256 pressure levels that are being detected on the pixels of this sensor, they're all being compared to one another. So with OccluSense, you get a relative reading of the pressure that is being applied. It's nothing absolute, it's a relative measurement. And they're constantly being compared to one another. Now, if we take this example of an OccluSense reading for static occlusion and you try to analyze it, the first thing that springs to mind is, all right, in the right molar region, we actually don't have any red columns. But this does not mean you don't have any high pressure there. In fact, if you look at the pressure distribution, which is noted by the percentages around the scalings, you will see that actually the highest pressure within the entire dental arch is located here. So it's 23 and 21%. It's nearly 50% right there. But why don't we have any red columns? What this tells you is that there is no standalone contacts with high pressure changes located in this area. However, the contacts are planar, everything always compared to the neighboring contacts, but the pressure here is higher overall. And the same level of detail you can deduct from readings for dynamic occlusion. I'm going to take you through a couple of features that I personally find quite helpful. So if you're going onto the OccluSense iPad app, you can amend your viewing options between two-dimensional and three-dimensional. Within two-dimensional, you see the quadrants with the pressure distribution, and three-dimensional viewing gives you the height of the columns. But if you, like me, feel like you're missing out, if you're taking one or the other, you also have the opportunity to take a combined view. So you have both in one screen. There's a lot of additional controls that you will find out when you're playing around with it. But just to summarize this a little bit, so you've got the full screen, the viewing options that you can amend. You have the opportunity to use your finger to turn your arch. You can do pause, speed, rewind, like you can do with any other video recording as well. You have the opportunity to do some noise cancelling. So if you think 256 pressure levels, they're a bit too much, you don't need them all. You can look at less. And you can also compare recordings. So if you have a patient with CMD and you've given them a splint, and after 6 months they present themselves again, you have the opportunity to compare their occlusion, and see what impact their muscles had on the occlusal positions and the static and dynamic occlusion. So in order to do the noise cancelling, so do less pressure levels than 256, you toggle the bar on the right-hand side of the display, and you can just go up and down to either increase or decrease your pressure levels. You also have the opportunity to export any data that you want from the iPad, either onto your camera roll or onto the Files app of your iPad. And in order to do that, you need to go into full screen mode. And once you're in full screen mode, the export button will appear. And when you press it, it prompts you to either select PDF or PNG. And then your file will be saved accordingly, including any notes that you've made with it. The same can be done for a video recording. So you go into full screen mode, then you go on to screen recording. And when you're on screen recording, so this is a little tip that I will give to you, you have the opportunity to also do some audio, add some audio comments and twist and turn the viewing option. So all of this, what you're doing during the screen recording, will also be exported. And when you're happy with your recording, you press stop, then export, and then you can share onto your camera roll. You can also use the app files from Apple to export the recordings to external drives or your network. If you want to do that, please take a look into our network access guide, which is supplied with every OccluSense. You may also download this online on our website. To get a clinical understanding of what is happening in the patient's mouth, you need to ensure that when you're inserting your sensor into the patient's mouth, you can see that in the black arrow on the sensor, the midline is marked. So the sensor will either have a red triangle marking this or a red line, but the midline will also be marked. And you need to ensure that your midline is inserted into your patient's midline. And once this is done, all the OccluSense scalings can be directly transferred. So all the lines that you can see on the sensor can separate the markings in the patient's mouth into different segments. So you have the opportunity to then trace back every marking to every column and vice versa. If we're looking in, for example, at this example, then you can see in blue a regular occlusion on a molar. So please make sure that you're taking a look at the clinical view with the markings on the teeth, as well as the 2-dimensional and 3-dimensional viewing. Orange, you saw a regular contact on a premolar, and in purple, you see a premature contact. Why do I say that? How do I know this is a premature contact? It's because if you're looking in the middle, the 2-dimensional viewing option of OccluSense, it shows you that in the left molar region, there's an increased pressure. So we have 50% of pressure right there. And you know, this is already something that's a bit odd, which is why you would go into your patient's mouth and check out what's the occlusion looking like clinically in my patient's mouth. And once you've done that, you can see that 36 has a buccal contact, which is absolutely not supposed to be there. So now we know we have a premature contact that we can very easily fabricate in order to give a nicer and more evened out occlusal picture. And the same you can do with dynamic occlusion. You can see here a non-balanced group guidance with most of the pressure being located in the bottom right quartile and a single contralateral contact antagonizing this movement. So if you imagine that 236 or 36, I'm sorry, the Germans say 36. If 36 was an implant that we had placed, which long and short-term consequences do you think that this improper loading will have on your implant and on the survival rate? And the same again with protrusion, where we can see that there's improper loading happening. I have a few clinical cases that I would also like to share with you. So the first patient is a bruxism patient, female. She presented herself with a ringing in the ear. She felt there was some cotton in there. She had a cervical spine with ligament sheath prolapse and also problems with her thyroid, muscle tension in her face between nose and ear. And when she presented herself to us, the first thing we obviously did was look at her occlusion. And what we very, very quickly saw, we have a primary pre-contact on 48. So that was very, very clear directly by looking at our OccluSense reading. And when you analyze this further, you can see that there's a very unbalanced loading with final heavy load between 41 and 45. That's a static occlusion. When looking at her protrusion, we again found parafunctionality on 48. And this parafunctionality on 48 prevailed within all the movements. So to the left, there's no canine guidance. And to the right, we had some group guidance with still, as said, the parafunctionality that prevailed. So we then had a look at her nocturnal movements. And her bruxism movements, they were mainly over 43, but 48 was still supporting this movement. And looking at the OccluSense spray results, you can see that in centric position, she actually had that parafunctional and premature contact on 48. And a very light fabrication of this contact actually led to her losing all the symptoms she introduced herself to us with. So, yeah, occlusion is much more than just teeth. You don't always need to have problems in order to use OccluSense. So you can also do very, very simple checkups for patients that don't have any issues. Here we've looked at this patient's static occlusion, and this is very nicely evened out. Please don't be irritated by the right molar region, which is a blank. It's just because in her fourth quadrant she's missing antagonists. So there's no pressure change that can be detected. And we can also look at her dynamic movement. So her lateral protrusion to the left nicely showed a beautiful marking on her 23. Similar with protrusion in this case. So there doesn't always need to be a problem. My last clinical example is an example of OccluSense and splint therapy and how you can use it to adjust your splint in a very accurate manner. This patient presented herself with this panoramic overview. And if you're looking at the condylar processes on the right and on the left-hand side, you can see different shapes and forms. So we actually have a case of hemimandibular hyperplasia here. And according to the differing development of the condyles, this patient suffers from craniomandibular dysfunction, whereby the occlusal interferences lead to teeth grinding, especially at night and during stressful periods in time. Since she chose no surgical intervention, the primary treatment involves preservative symptom management, whereby we fitted a night guard and protected the teeth and the joints. This is her static occlusion without the night guard fitted. So I want you to look at particularly the occlusal interferences and the disbalances, but also the force distribution. And you can see that she has an open bite on the left-hand side. So to begin with, there's contacts only on one side. And as the bite advances, the next contact slide into place. Let me go back so you can see this more clearly. So we can see she has an open bite on one side, yeah? It starts on this side and then the bite advances further. And we have via sliding and guiding, sliding and gliding, more contacts. So I want you to think about how you test a splint on a patient or how you're fitting the splint on your patient rather. The way that we do it, we use a premolar sized shim stock foil, and then we insert it into the patient's mouth all around the arch, and then we pull out. And we try to get roughly the same amount of resistance when you're trying to also use the same amount of force when you're pulling out the occlusal paper or the shim stock foil. And if you have contacts everywhere where you want to have contacts, then you would send the patient home because you're like, all right, where the splint, you have a balanced occlusion everywhere. And then we schedule them back in a couple of weeks' time. So we did that with her as well. And she presented herself after a couple of weeks with similar issues. So she still had pains, she still had joint pains, she was still grinding a lot, which is why we then looked at her splint occlusion with OccluSense. And this is what it looked like. If you remember the pathway diagram that I showed you, then you know that with occlusion, with foils and papers, you get a picture, so a snapshot at a given moment in time at the end. So if you're looking at this OccluSense reading, this is roughly the end. And if you're thinking about your shim stock foil that you're pulling out everywhere, you will get roughly the same resistance everywhere. So right now, to us with the shim stock foil, this would be an evenly balanced occlusion, but we're missing everything that is happening beforehand. And what is happening beforehand was shown to us with OccluSense. So right at the beginning, there's a improper balance in the anterior left region. And this balance continues, continues, continues. So we have way too much force here. Continues, continues until later it then slides into intercuspidation. But it we missed that this was an uneven force distribution, which is why this patient was then suffering from the symptoms that she was. And the same checks can be done for dynamic occlusion. The splint was fabricated for canine guidance using acrylic plateaus, and we can see that some other teeth in the front are also guiding the movement, and you can fabricate this by then drilling accordingly. So this is the OccluSense reading for this. You can then move on to protrusion to finalize the process. And that's all. So maybe the most relevant question for you now, does OccluSense replace articulating paper or foils? I would say it very much depends on the indication. I would not throw any one of them out of my treatments because papers and foils, they give me a picture. Sometimes I only want to take a picture in life. And OccluSense allows me to take a video recording. Some moments I want to capture as a entire moment. I need the entire video. So the algorithm that I can suggest to you is to think about using OccluSense right at the beginning to check for premature contacts and the pressure distribution, to then do any fine adjustment using occlusion paper and foils, and to check your treatment with OccluSense at the end. What you are also automatically doing, you're documenting everything. So for forensic purposes, a very nice to have. We've had experts all over the world who kindly not only shared their feedback, but also their cases with us. So if you feel the need to discuss any cases or look at new treatment methods for OccluSense, feel free to get in touch with us. So obviously, as mentioned in the examples, okay. I just had a little glitch. I hope that you can all see my screen. But as I mentioned in the example previously, CMD is a much more becoming popular treatment method for OccluSense. But not only that, you can use it within prosthodontics, within implant treatments, within normal fillings, so whatever your heart desires. If you want to get started, you will need an iPad that is produced no later than 2014. You need the iPad app, which you can download on the Apple Store. And you need a Wi-Fi connection as well as the system accessories of your test sensors in there. You have your handheld, you have a wireless docking station, the test sensor I think I already mentioned, instructions for use, and some sensors to get you started with. Okay, I guess that is all from my side. I want to thank you very much for your attention today. And yeah, I don't know where you guys are based, but I'm sitting in Cologne. It's actually quite dark outside. Um, it's 20 to 7 in the evening. And if you have any questions for me, please feel free to either write them in the chat or turn on your mic and just feel free to speak. Also, note down my email address. If you think of anything in the future, you are more than welcome to drop me an email or message me on LinkedIn by scanning this code and connecting with me. So, is there any questions? Or are there any questions? Yeah, as said, so note down my email address. If you can think of anything in the future or whilst you're using OccluSense, any cases you want to discuss, feel free to get in touch. And I'm wishing everyone a very lovely weekend. And yeah, very nice to hear you. Have a nice day.